Well, good afternoon. My name is David Kimberlin. I'm co-director of the Division of Pediatric Infectious Diseases here at the University of Alabama at Birmingham and Children's of Alabama. We're gathered today to talk about an update of the enterovirus 68 outbreak around the country, and specifically what we know about issues here in Birmingham, and then perhaps touch as well on influenza-related issues, specifically relating to vaccine availability. In terms of the enterovirus information that we have available, generally speaking, the numbers of respiratory cases that have been recognized, since mid-August or so, have been decreasing over the past several weeks. So it would appear that that respiratory illness has peaked and now is on the decline. Respiratory illness that was recognized around the country, including in the Birmingham area, beginning in mid to the latter part of August and continuing into September, that has been decreasing in frequency. We're not seeing as many patients coming into the emergency room or being admitted to the hospital with those respiratory-like illnesses. Now, we have seen an increased number of those patients be testing positive for enteroviruses in general. And part of that, I think, reflects that the doctors here at Children's, and indeed doctors around the city and around the state, are testing more children for enterovirus. So we're testing more, and therefore we're finding more. We have sent about 20 of our specimens from 20 different patients or so to the Centers for Disease Control and Prevention for them to do confirmatory testing for enterovirus 68, enterovirus 68 being one of more than 100 different enteroviruses that are known to exist in the world, and likely the one that's causing certainly a lot of illness around other parts of the country, and presumably causing illness here in Birmingham with the respiratory symptoms that we talked about last time we gathered, the wheezing, the low oxygen in the blood, the rapid breathing, and difficulty getting your breath. We have tested here in our lab a number of those patients as well. And in one of those patients with respiratory symptoms who had tested positive for enterovirus as a group, we were able to confirm that that patient had the enterovirus 68. Now, CDC has not provided their confirmation to that, but the degree of acuity with which and accuracy with which our testing was performed leads us to be confident that, yes, in fact, that patient had an enterovirus 68 illness. That would mean that we have confirmation in the lab of what we all expected clinically. It's not really new information, it's just confirmatory information. We had illness that matched the illness seen in the Midwest. The illness in the Midwest was proven to be related to enterovirus 68. We simply now have confirmation that at least in one patient, the illness we saw here in that patient was from enterovirus 68. Now, this past Friday, the Centers for Disease Control and Prevention released a health alert network advisory asking centers all around the country to be watching for cases of children coming in with limb weakness, in other words, with weakness in an arm or in a leg. We, in fact, have had 3 such patients here in August and in September. And if you go back in time, patients like this have been recognized for at least the last 2 years, going out to 2012 in California. Not all of those patients are believed, and in fact, none of the patients have been confirmed to have their illness caused by enterovirus 68. For the 2 of the 3 that we had here in Birmingham, 2 of them tested positive for enterovirus from a stool sample. That's the broad grouping of enteroviruses from a stool sample. 1 tested negative for enterovirus. We do not know any additional information about the type of enterovirus for the 2 that tested positive. But keep in mind as well that simply because someone tests positive for enterovirus in the stool, that does not mean that the enterovirus is causing whatever illness or disease they happen to have. When someone gets infected with enterovirus, they will shed that enterovirus. They will have it detectable with the very sophisticated laboratory testing techniques that we use for a number of days and weeks after the illness. So simply testing positive in stool does not mean that there's a causative relationship, that it was the cause of the weakness in the arms or the legs. Around the country, what we're understanding is that the patients who have had limb weakness for whatever reason, whether it's enterovirus 68 related or not, still yet to be proven, that among those patients there is a quite slow recovery from that. It's not something that they seem to bounce back from very quickly. If it happens at all in relation to a viral infection, specifically an enteroviral infection, it is very rare. It is very rare to have these, as best we know with the information available to us now, these limb weakness conditions. For example, in Denver, where they report, that was what the subject of the CDC Health Alert Network advisory was. In Denver, they had 9 such patients, and 4 of those patients tested positive for the enterovirus 68. Now, you may recall as well that Denver previously had reported 900 cases of respiratory illness in their emergency rooms and in their hitting their health system. So if 4 have enterovirus 68 related limb weakness and 900 have what may be an enterovirus 68 respiratory illness, you can do the math on that and realize that it's well less than 1% of patients who might have this, less than 0.5% of patients. So this is something that, number one, we don't know if there's an association for. Number two, if there is an association, based upon all the evidence that we have right now, it is very rare. I'm open to any questions that you may have.
How contagious is it?
When we spoke last time in September, we were primarily discussing the respiratory illnesses related to either enteroviruses or to enterovirus 68 in particular. Enteroviruses are a very common group of viruses, family of viruses, and they cause disease extremely commonly this time of year. Anywhere from May, late April, May, through October is enteroviral season. So many times when people have summertime colds, they're due to enteroviruses. So in the same way that a cold is contagious and you need to wash your hands well or use the hand sanitizers, the same would be true for enterovirus 68. So it is contagious, but usually it causes either a mild disease or a disease that certainly, if it's more severe with the respiratory symptoms, can be managed in the hospital with the supportive care that we have available to us at Children's of Alabama and at other tertiary pediatric hospitals have as well.
So the one confirmed case in the lab here at Children's, correct?
There was one confirmed case in the lab here at Children's of a child with a respiratory illness that was consistent with the enterovirus 68 type of presentation that other parts of the country had already confirmed or linked with enterovirus 68. So simply here, all we have now that we didn't have before is confirmation instead of just assumption that we've had enterovirus 68 here in Birmingham.
You know how many that brings to the state? Does that mean there's 5 confirmed cases in the state now?
My understanding is that CDC has confirmed 4 cases of enterovirus 68 in Mobile. I'm not aware of additional confirmation from CDC of other cases in the state of Alabama. But our case, while not having yet been confirmed by the CDC, we actually sequenced the genetic material of the virus and it matched the enterovirus 68. So that's as hard confirmation as we need.
How many suspected cases of the possible neurological issue are you seeing here? Is it 2? Are there multiple?
We've had 3 patients, 1 in August and 2 in September, that had weakness in their arm or their leg. And right now, I'll restate again, we do not know that, number one, enterovirus has caused that illness, and we don't know if it is enterovirus that's infecting them, that it's enterovirus 68. So, and not only do we not know that, but the CDC doesn't even know that yet. So that's the purpose of the alert that went out this past Friday, was simply to raise awareness so that if there are cases such as those that we see here, and there are cases scattered around the country, that all of that information can be pooled at the CDC and they can get a better and more accurate and hopefully more rapid assessment of what's going on.
So at this point today, what's new is that you have one confirmed case of enterovirus here at Children's of Alabama. Is that correct?
What's new at this time are three things. One, the amount of respiratory illness that we're seeing from the community is decreasing. So things seem to be on the downward slide, which is good. Number two, that one of the patients who did have respiratory illness, we now have confirmed to have enterovirus 68. And then number three are these 3 cases of weakness in the arms or the legs that we do not know, and in fact no one around the country knows, whether there's an association or a relation between enterovirus, and more specifically enterovirus 68, and those clinical presentations.
How ill are the 3 presenting neurological? Are they still in the hospital? Are they able to move along?
I'm not directly involved with their care, and so I don't have specific information along those lines.
What about the one patient with the enterovirus? Are you able to provide an update on that patient's condition?
I'm not able to do that right now.
And earlier, when you got started, you mentioned that you've sent 20 specimens to the CDC. That's to confirm this virus? Or can you elaborate on that?
Yes, ma'am. We have sent about 20 specimens from about 20 patients with respiratory illness to the Centers for Disease Control and Prevention, so that and those patients had tested positive in our lab for enteroviruses. So that big family of 100 enteroviruses, they tested positive for that. And CDC is now doing their confirmatory testing on those 20 or so specimens to see if the enterovirus that we detected was the enterovirus 68. And in addition, of those 20 or so, one of them is one where we have our own confirmation independent of CDC, as I just mentioned a minute ago.
And when do you think the CDC will return those results to you?
We don't know for sure when the CDC will get those back to us. Our anticipation is that it may be within a handful of days. But CDC has received a lot of specimens from all over the country, and I know they're working incredibly hard. They're quite backlogged, so we're not quite sure when that will be.
What's the latest that you can give us about the influenza virus that you are seeing?
So shifting gears to influenza now, a different respiratory virus. The main news, a couple of things we have right now for you with respect to enterovirus. I'm sorry, with respect to influenza. We have seen 3 patients test positive for influenza over the last handful of weeks. And that's testing both with the very sophisticated testing that we're capable of in our molecular diagnostic lab, as well as the rapid testing that's done at the bedside down in the emergency room. And furthermore, we've tested more patients for influenza that have tested negative. So for where we are now, very early October, seeing 3 patients with influenza is normal this time of year. We're not seeing an increase in the number of patients that are testing positive that would suggest we've actually hit influenza season yet. So that's yet to come. We will hit influenza season. You always do have an influenza season every single year. Most likely it will be in January, February, because that's when it usually is, but it could be earlier. Right now we don't have evidence that it will be earlier. Second thing with influenza is that by far the best thing to do to prevent influenza is to receive the influenza vaccine. Every year in the United States, between 100 and 300 children die of influenza. Last year it was about 108 children died throughout the entire United States from influenza. This is a vaccine-preventable disease, and parents should definitely follow the recommendations of the American Academy of Pediatrics and the Centers for Disease Control and Prevention, and have all children, and in fact all Americans, 6 months of age and older, receive their influenza vaccine. Now, we are having some shortages around the country with respect to delivery of the influenza vaccine. All manufacturers of influenza vaccine have had issues relating to supply and shipment of those supplies. So I would encourage families, as they follow through and get their children immunized, for them to call ahead to their healthcare provider and make sure that they have adequate supplies on hand, so they don't go to the office and only to be told that they'll have to come back another time.
And is it specifically the shot that you all are seeing shortages in, or is it the shot
There's, as you know, two different types of influenza vaccine. There's the injectable vaccine made by a number of different manufacturers, and then there's a mist or a nasal vaccine that's made by one manufacturer. All manufacturers, both injectable and mist, are having supply issues at the national level. Now, the thing that's challenging about this is that even though globally there's issues of supply and getting the supply to where it needs to be, some places have adequate supplies, and within parts of the country or parts of a city, for instance. So that's why it's important for families to call ahead to their pediatrician or to their family practitioner's office and just make sure they have supply available so that they can use their time wisely in terms of getting there to get the vaccine. But all people 6 months of age and older in the United States should receive the influenza vaccine unless there's a contraindication to do so, and those are rare. Those contraindications are rare. Flu vaccine will save lives.
Any concerns about Ebola?
Well, you all know with the Ebola news over the last several days, a couple of days, I guess, out of Dallas, Presbyterian Hospital in Dallas, there has been one case of an adult who arrived from West Africa to visit friends and family in the United States, who developed symptoms after he landed in the United States, subsequently was hospitalized, tested positive for Ebola. This is not unexpected. The size of the outbreak in West Africa is very concerning and has been concerning for some time now to public health officials. And virtually everybody anticipated that cases would be reported around the world as we have this interconnected global network of flights and so forth and travel. So what I would say in terms of Ebola in the United States has been reiterated even better from the folks in Dallas and from Tom Frieden at CDC. The kinds of infection control practices that we have in place as standard routine care in the United States, at all hospitals in the United States, Children's of Alabama, all hospitals in Birmingham, University Hospital, those are tried and true methods that will contain the spread of Ebola should a patient in a given locale be diagnosed with Ebola. In addition, CDC and other public health groups have very sophisticated tracking mechanisms whereby they can track down people who have had exposure to somebody with Ebola, as is happening now in Dallas. My understanding, about 12 or 18 people have had close contact with this patient who now has been diagnosed with Ebola. And they will follow those patients for the next 21 days, or those people for the next 21 days, to make sure they don't develop Ebola symptoms. That will contain this within the United States. I'm not worried about Ebola spreading within the United States simply because we have a top-tier medical system throughout the country, whereas in West Africa they don't have that.
How as a parent do I know the difference between the flu and norovirus 68?
Right now, enterovirus 68 season is anticipated to wind down around the time or before influenza season ramps up. In other words, influenza usually is going to be December, January, February, March, whereas enterovirus is going to be any time from, including enterovirus 68 presumably, anytime between May or June and the end of October. So there shouldn't be a lot of overlap between the two in terms of widespread circulation. Now, to get to your question, the more some of the components between the two can be similar. With enterovirus 68, there seems to be more wheezing associated. We usually would not see wheezing with influenza. We would expect to see respiratory distress with either influenza or enterovirus 68. And then with influenza, we are more likely to have higher fevers than would be the case with enterovirus 68. So fever more likely with influenza, wheezing more likely with enterovirus 68, respiratory illness, including respiratory distress, if somebody has more severe infection, can really be with either of them.
What do you think the timing of the two distinct illnesses seasons will prevent them from overlapping and causing parents confusion?
With a typical enterovirus season and a typical influenza season, they would not overlap, or the overlap would be very short. And so I would not anticipate there will be much difficulty with that over these next several months. Now, I'll add the caveat that enterovirus 68 has not spread rapidly or widely like this around the country before. This is kind of new territory for us. So we'll be watching very carefully, and we'll see what happens in terms of the seasonality of enterovirus 68. But if it behaves like other enteroviruses, it should be winding down, later this month or as we get into November.
Just one more question about the Ebola outbreak. I heard that the patient who is now in quarantine was sent home 4 days before he is now in quarantine. Is the threat going to be taken more seriously now that we know that there is the possibility of contamination with the people he's been in contact with? We're not just going to send somebody home just because he may not have it.
My understanding from that timeline is that the person arrived in the United States on the 20th of September, had initial symptoms on the 24th of September, and was seen about 2 days later on the 26th, sent home at that point, and then represented and was hospitalized on the 28th. So it was a two-day delay instead of the 4 days that you alluded to in your question. I think, though, the main thing that this case will do is to drive home the message that CDC has been delivering to all healthcare providers around the country for a number of weeks now, and that is take a travel history. Find out if the patient has been to West Africa, and if they have been to West Africa and they have symptoms that could be consistent with Ebola, isolate them immediately and perform testing.
Do you think the CDC will take measures to limit travel from the West African countries that are affected now that we have had somebody come in that has been infected with Ebola?
It's a good question, and I don't know the answer to that. That certainly would be not only, I'm sure, a CDC issue, but a State Department issue, which is well above my pay grade.
So is the message to parents at this point in regards to EV68, the parents can stand down a little bit?
I think with EV68, the overall message is that what we were seeing with respect to these respiratory illnesses, they're falling off in number. The volume is not as high, anywhere near as high as it was several weeks ago. And that's not only here in Birmingham, that's around the country as well. So I think that part is the main message. Parents should continue to watch for the things they've been watching for before they even heard of enterovirus 68, and that's how their child's breathing. If they're having a heavy breathing, hard breathing, pulling in with their muscles between their ribs, for instance, because they're having such a hard time getting their breath, or really harsh audible wheezes that the parent can hear, where they just look like they're really sick, those are times that they should be calling their pediatrician, or if necessary, coming to the emergency room, or most of the time, though, it could be handled with a call to the pediatrician and then going to be seen in the pediatrician's office. So those things a parent was going to be doing in 2013 and 2003 and 1963. So that what we know now that's different than that is that there's this virus called enterovirus 68 that's caused those symptoms. Maybe not all of the symptoms. There's other viruses circulating right now as well that can do the same thing. But at least in some of the cases, and including one case here in Birmingham, EV68 was the cause.
Back to the neurological symptoms. So you've had 3 that presented with those symptoms, and 1 confirmed enterovirus, but not necessarily 68.
We've had 3 present with weakness in one of their arms or legs, or more than one of their arms or legs. Of those 3, 2 have tested positive for enterovirus in their stool, their poop, and 1 has tested negative from all sites for enterovirus. We do not know several things. First of all, we do not know that the enterovirus that was in the stool of those 2 patients actually caused their illness. Because enterovirus, once you have it, you're going to, even after you're over the illness, it's going to be detectable in your stool for quite some time after that. And then we also don't know whether the enterovirus that we saw in our lab was actually enterovirus 68 or not. That is being confirmed or being looked at the CDC.
But 1 was clear of enterovirus.
At least we did not detect enterovirus in one of those patients. That's correct.
That was August 1 and August 2 in September?
Yes, sir, that's correct. And the time frame matches pretty well with the CDC Health Alert Network paper that came out. That was about the time that Denver was seeing their patients as well. But I'll reiterate that these patients like this have been recognized for at least the last couple of years, back to 2012 in California. And so it very well may be that our attention to those patients now, which is appropriate to focus on those patients, that it's separate and apart from this whole enterovirus outbreak or enterovirus 68 outbreak. They also may be an association there. If it is an association, it is a very rare association.
Any other questions? Okay, thank you.
Thank you very much.